Right. All right, well, welcome everyone. We'll be starting in just a moment. Thank you for joining us. Well, welcome everyone. We'll be starting in just a moment. We're going to give another minute or two for people to settle in. Thank you again for joining us. Well, welcome everyone. We'll be starting in just a moment. We'll give another minute or so. All right. Well, welcome to the Lunch and Learn session, and thank you for joining us today. My name is Keiko Miyahara from the UCSF California Oral Health Technical Assistance Center, and I'll be hosting today's presentation. So some housekeeping before we start. Everyone is muted, so if you experience any technical issues, please use the chat box to connect for help. Please use the Q&A box to ask questions during the webinar. This presentation will be recorded and the recording will be available on the COTAX website. We also have a post-webinar survey, and we kindly ask for everyone to complete the short survey. So I'm delighted to introduce today's Lunch and Learn speaker, Matt Jacob. For more than 25 years, Matt has worked with nonprofits and advocacy organizations to strengthen the quality and impact of their communications. He's the owner of Jacob Strategies, a consultancy that works with public health organizations, primarily those in the field of oral health. Previous, Matt managed communications and media outreach for the Pew Children's Dental Campaign and the Children's Dental Health Campaign. Matt's training sessions draw from his own experience, both as a former journalist and as someone reaching out to journalists on behalf of health policy advocates. So welcome, Matt. I would like to turn this presentation over to you.
Thank you, Keiko, so much. I appreciate it. Can everybody hear me all right? The audio levels are okay?
Yes,
great.
That's great.
All right, so I'm going to go ahead and get my slides activated here. Great. All right, well, thank you so much for spending your lunch hour with me, a little more than the hour. I understand we're going to go into the next half hour. So let me, without further ado, just walk you through our objectives for the lunch hour here. We want to, first of all, distinguish strategies that should be used before, during, or after a media interview, because some things are things you really need to be thinking about before you actually do that interview. And some of the techniques and tips that we're going to offer are things that you would actually put into place during the interview. Secondly, we're going to understand why creating a few sound bites early ahead of time is really important, and we're going to talk about 5 approaches to those sound bites. Third, we're going to, I think, collectively understand the benefits of what I call buying time before an interview. And last but not least, we're going to hopefully put you in a position where you feel like you are ready to use 3 strategies to stay on message and keep interviews from going astray. So without further ado, let's step forward. So this is now before an interview, okay? This is just to be ready. And so we're going to talk about how to prepare for successful interviews. Some of this I know, some of you may have seen trainings that I've done, and I covered a few of these, but I think these do bear some repeating. You know, we really want to encourage you to be proactive with local media, and I know so many of you have done that, and I really applaud that. You know, in other words, you're not waiting for a reporter or a local radio show host to contact you. You're thinking about ideas that you feel are newsworthy, and you're reaching out to them. And then, you know, if a reporter writes a good article about oral health or something that's really closely related to oral health, I think it's always a good idea to send an email that thanks them, even if you weren't in the story. If they didn't mention your local health department or your nonprofit, it's still a way to both applaud that effort, and by doing so, you sort of put yourself and your organization on their radar screen. So the next time they write about this, they're just a little more likely to come looking for you. And then if you want to correct something in a media story, you know, I think this is a good idea, but I think you have to proceed with care. I always like to start with a compliment. If nothing else, just thank them for covering the topic and mentioning that, you know, oral health is an overlooked topic, and that you appreciate that they did a story on this, or they covered the issue on a talk show, et cetera. But I think you want to be careful about not using judgmental language. Usually this is typed in an email, and in written communication, it's very easy for people to make assumptions about the degree to which you're being judgmental, et cetera. My experience is that the overwhelming majority of reporters and editors and radio show, TV talk show hosts, online media are trying to get it right. They're genuinely trying to do the right thing, to write a story that has breadth, that is accurate, et cetera. Sometimes they get it wrong. Sometimes they leave out an important detail. And there are ways to bring that to their attention, or just to clarify something that you feel readers might misinterpret. So choose your language carefully. I don't want to discourage you from reaching out. I think it's a great thing to chime in, but just, I'm not sure, for example, I would use the term correct. I want to correct something in your story. That's generally language I avoid. I would say, you know, I'm concerned that some readers might misinterpret a paragraph or sentence in your story. Here's the one I'm talking about. You know, I just kind of want to make sure you're aware that the way this program works is blah, 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 right? So, you know, give that explanation, be as brief as you can. We also want to encourage you to use plain language in your press statements, in also your answers, right, that you give when you're being interviewed live or being interviewed for background, or, you know, by a newspaper. So I think you all know that means you're going to avoid clinical language, policy, wonk language, technical terms that many people won't understand. And this is just an example of that. I always like to lend humanity to this issue. And so it's why I tend to, while I understand people work in population health and we should take pride in that, I tend to avoid saying populations or pediatric population. We're talking about children, right? You know, and so, you know, geriatric population, we're talking about older adults. So my gut is to really use those terms that are more accessible. Reporters, most of them are going to know what CDC means, but I think on the first reference, it's always helpful to say the Centers for Disease Control and Prevention. selecting your best data, right? So, you really want your data to be part of the story and support the story. And so choose the data very strategically. I think it's a good idea to limit yourself to no more than 3 statistics in your answers or in your comments that you're going to give, or in even a single press release. Now, that is not to say you can't have a table or a graphic at the end or a spreadsheet or something that does provide a deeper dive. But I think you want to avoid throwing lots of percentages, lots of fractions, lots of proportional data at people in the narrative of a release. And when you're being interviewed, even in your answers, you really want to go into that interview on the phone or in person or in the studio, thinking about, okay, what are my 3 best facts or statistics that I can use that are going to really be powerful? And I personally think it's a good idea to try and use proportions or fractions rather than percentages, because sometimes percentages have the effect of downplaying an issue or a problem. So I just think, 16% sounds like a really low percentage, doesn't it? But if you tell people 1 in 6 children, will need cavity treatments by the time, they are 7 or something like that, suddenly you put it in a different perspective. When we say 1 in 4 adults, for example, I think what happens is we hear that proportion or that ratio, and we tend to reflect on our own family, our own workplace. If we work with 12 people at our office or our nonprofit, et cetera, and we hear 1 in 4, suddenly there's something that allows us to say, hey, wow, that's like 3 out of my employer. 3 employees would have this problem or this issue. This would apply to 3 of us. So I think it gives people a way to kind of take a statistic and kind of apply it to their own family or their own workplace or their own micro community. So there are a whole lot of questions you're going to be asked. With very rare exceptions, you're probably not going to get more than 3 genuinely, tough questions. And so I always think it's great in advance to be ready for that. So think of the 3 toughest cues that you could be asked. And so you want to start kind of teasing out answers. What would you say if you were asked that question? You don't want to sound like you're ducking or dodging. And so you want to construct answers and responses and look for a colleague who will give you honest feedback, not just nod their head, but really be honest and say, I love that first answer. The second one, that doesn't really sound like it's responding to the question. It seems a little evasive. Maybe you should try this. So, on that feedback, you're going to be able to hone and refine those answers so that they become stronger. But I would really kind of limit it to 3. What are the 3 toughest questions you could be asked? If you have those covered, you're going to go into that interview with much more confidence. It's not just what you say, but it's how you say it, right? And I think in the age of Zoom, where Zoom communications are taking over so much of the interaction in the meeting space and the training activities, how you say it matters too. So just kind of keep that in mind. And with anything, radio, TV, having those tools, understanding inflection, adjusting your vocal tone, sometimes your pace changes. Inserting a pregnant pause at a really critical stage can be a way to highlight what you're about to say, right? So as you go on and you become a little more used to doing some interviews, you're really starting to work some of these techniques in. Even when it's not a recorded interview, I think it can be helpful because it helps a newspaper reporter who's on the phone with you can help keep their attention, just because your vocal variety and differentiation kind of helps them understand what's important. We're still before an interview, and this is the last point in preparation, pre-interview, and that is sound bites. This is the language of the news media, right? People speak in sound bites. If you have an answer to give and it's a minute and a half, guess what? They're not going to feature all of that as a quote in a newspaper article, in an online news outlet. it's just going to be too long. You know, they might take a part of that, but they're not going to take all of it. So the more you speak in sound bites, the more you're using their language, and they're more likely to use, if not verbatim, pretty close to what you say, or they're going to quote you, because people want quotes to be pithy, to be really quick and clear. So before you reach out, before you have a press release, you know, related to these issues, you want to create 2 or 3 sound bites that you really feel will cover the key points. What are the takeaways, right? Broadcast media in particular. Yes.
Matt, I'm sorry to stop you. We're not seeing the presentation.
Oh, okay. Let me see if I can. Let's see here. Sorry about that. Let me go ahead and share screen again and see if that solves the problem.
Great.
Okay. Can you see it okay?
Yes, thank you so much.
Okay, great. Thanks for interjecting. So not only do we want you to develop these sound bites, but practice saying them, you know, and I think that's important too, is you really want to come across authentic. So if it doesn't sound like you, if you're using quirky language or language that just isn't you, that's probably going to come across in some way. So you might want to hone it, you might want to revise it, so you really feel like it's you, and it's not, you're not using somebody else's words. Somebody might have a great sound bite, but they might use a few words or terms that just don't sound like you. And so for the sake of authenticity, you should feel free to refine that. And I would say 30 seconds is the maximum. Frankly, you're better off getting closer to 20 seconds. But, you know, if it's longer than 30 seconds to say, it's not a sound bite. And you know, the shorter, the better. So how do you create these sound bites? Well, I want to give you 5 tips, and that I think are really going to put you on the right path to making it easier to come up with sound bites. So first thing is, analogies can be very powerful. They help us put things in context. And if the analogy connects with something that we as a parent, as a consumer, a patient sort of already understand, then it has a stickiness to it, right? It's going to connect and somehow become clearer to us. So this is a phrase that I've heard people use, and I really like it. I really think it puts that in perspective. The mouth is the front door to our bodies, right? If it isn't healthy, the rest of our body won't be healthy. That's just one example. This is another example. You know, using toothpaste without fluoride would be like using seatbelts without buckles, right? So, you know, thinking of a way to really kind of make it hit home. You could just say it's important to use toothpaste that contains fluoride, right? But, you know, this is a way that I think causes people to stop and really, it kind of sinks in a different way. The second approach is to play off a particular word or sound. And you may not, these are a little trickier to think of, but I'll bet you most of you at some time or another have said something that fits this approach. So here's just one example. Age 2 is too late. Parents should take their child to see a dentist no later than their first birthday. So when you have age 2 is too late, it's easier for people to remember that repetitious sound means that when I hear that, I'm more likely to retain that. And so that's true for reporters. I will also say, I think this is very important for broader audiences and stakeholders. When you're talking to parents, when you're talking to family health advocates and children's advocates, this is a good way to really, you know, when you step away from the podium, people are just more likely to remember what you said. Here's another example. You know, the example being, you know, our initiative is aimed at achieving 2 things: make dental care more accessible and more affordable. You remember I spoke moments ago of the importance of inflection and emphasis and stress. This is a good example of that, because you hit that word more at a certain tone, more accessible, more affordable, in a way that really people kind of walk away and they remember that you mentioned accessibility and affordability. Third, anything you can do, we can do collectively to help our audience feel the problem, right? I think public health is a field where we tend to focus on changing how people think about the problem. And we assume that if they think differently about the problem, their behavior will change as well. But part of this is not just changing how they think about it, changing how they feel about it, right? So we're not just going to speak to their brains, we're going to speak to their hearts. And connecting with people on a visceral level can be very powerful. So I heard somebody at a symposium many years ago make this statement: I've never had a toothache. I've been fortunate enough not to have that. And when I heard that, I thought, oh my gosh, I can only imagine, putting it in perspective. I have had a bee sting many times. And so hearing this, it enabled someone like me to kind of begin to grasp what it's like to truly have a toothache. So, anything we can do to put things in a perspective that enables our audience to feel the problem is worth doing. Fourth approach to creating sound bites: express a value or a belief that your audience is likely to share. I think this statement is an expression of a value that most people in almost any audience are going to nod their head to. I don't think most people would say, no, they shouldn't have that. They shouldn't be going to bed pain-free. Most people are going to say, if not everybody, yeah, of course. It's unthinkable that any child has to, go to bed with an aching tooth. So connecting there, right? You get an audience, and remember, in some ways, your audience is the reporter or the TV show host or radio show host. In reality, your audience is their audience, right? It's the people who are going to be reading or listening to that content. So really connecting with them and thinking about what might be a value or belief that they're going to share. So you get them. This is a statement ideally you want to make early in an interview or early in a radio show or TV show interview, because it really frames this, right? You get your audience agreeing with your baseline value, your foundational value, and that's a great place to start to then say, let's talk about solutions. How do we help bring this about, that more children are happy and healthy, have healthy mouths? This is another statement, just a simple example of that. I think, I was coaching somebody who gives a lot of presentations on oral health. And one of the things that we kind of worked together, collaborated on, was her opening a talk she was going to give, a presentation, by saying, it is my belief that no American should have to be ashamed of smiling for fear that someone will see the condition of their teeth. And raising her hand and saying, who in this room agrees with me that we should have that kind of a country where no person, child or adult, feels ashamed of their teeth? So just, it's a real kind of basic way to kind of establish hey, we're in agreement on this, right? Okay, here's where we go. Last but not least, connecting the dots to other issues, right? And so one of the things that I think we can overlook at times, and what I'm really pleased with, is UCSF's, the Oral Health Technical Assistance Center, so many of the advocates that I've interacted with and talked with, you get this, but not everybody does. I mean, I think it's really important, right, that when we're talking about oral health, we're not just talking about oral health. We're talking about jobs. We're talking about unnecessary costs to our healthcare system, right? We're talking about educational achievement, right? There are so many ways in which oral health impacts those things. It also impacts our overall health, right? Diabetes, hypertension. There are a lot of links to cardiovascular health. So any way we can connect those dots is also a nice way of having an impact. Suppose you're being interviewed by a local business community newspaper or journal. Really important right up front that you connect the dots to employment prospects and job growth. All right, now we're in the interview, right? Somebody emails you or they call you and they make the request. Hey, I'm writing the story, or I host this 90-minute program on public radio. Would love to be able to have you on. So you've gotten the invitation, and here's where you are. So I think it's important, assuming it's not a radio show or a TV show where you'll be showing up in person, right? If it's a reporter, online, newspaper or otherwise, or a blogger who wants to get you on the phone, I generally say, tell them you can't talk right now. Ask them what their deadline is. Make it clear, I'd love to speak with you. I'm kind of just getting ready to enter a meeting, make up some excuse, whatever it is. And just ask them what is their deadline, and I'll make every effort to follow up with you. And then ask them one last thing to add. What specific topics do you want the interview to focus on? Sometimes they'll make that pretty clear, but a lot of times they'll just say, hey, I want to talk to you about dental health. So you might say, do you want to focus on children's dental health? Or are you interested in, talking about this facet or this facet, et cetera? So as much detail as you can get from them is going to be helpful in you being able to prepare effectively. Then I say, go online and learn whatever you can about the reporter. Even if they need to talk, they say, hey, my deadline is in 3 hours, feel really bad. I know this is short notice, but I'd love to get you on the phone. Even if you only have 2 or 3 hours, you're better off buying yourself some time so you can go online, find out what else has this reporter written. Have they covered this issue before? If they have, you probably won't need to fill in as many of the basics about oral health as you might otherwise. But if they haven't, you're going to have to be aware of that. So quick story here. I was working at Pew. We got a call from the New York Times. They wanted to interview Shelley Geshen, who was the lead of our project, about oral health issues. I said, I'll be happy to talk with her. What's your deadline? I went online and I found out something very quickly. Even though the New York Times has a number of health and science reporters, the reporter who had called me, who had been assigned to do this particular story, was a woman who typically covers real estate issues in New York City, in the 5 boroughs of New York. So that immediately told me, wow, okay, clearly the others were busy working on other stories. So we're going to need to really create more of a foundation here. Shelley's going to need to point out that tooth decay is the most common chronic disease for children and teens. Make sure that that's there, because this reporter is not coming in, more than likely, with that really important baseline knowledge about oral health. So just keep that in mind. You also want to get a sense of the rigor they bring to their stories. Are they focusing on facts? Are they interviewing key experts? Or are they focusing more on the controversy? Or, are they interviewing people who seem quite peripheral or not really experts in the field? That's just important. It can be a nice wake-up call for you just to be a little more prepared if they want to try and kind of turn a story into a controversy. During the interview, obviously, don't be defensive if you get a question you weren't expecting. Take a deep breath. Be polite. Even if you're not thrilled with the direction they're trying to take it, and you always have more to lose by becoming hostile, by being flippant, by responding in a way that might seem disrespectful. Keeping your cool, taking that deep breath, can be very, very helpful. Most importantly, when you do give an answer, don't repeat negative language. Now, a lot of reporters and editors, they'll sometimes ask something. Most people will ask one question at least that's a little bit of a tough one that kind of pushes back maybe on your core message. So you want to be ready, and you want to make sure and understand that just because they ask the question in a certain way does not require that you have to respond accordingly, right? So if you get a question like this, which is pretty loaded, right? And it's framed in a very negative way. You don't want to say, no, it isn't fair to blame parents because, so suddenly you're answering in this context of parents and blame, right? It's not really a good place to be. Instead, think about something like this, right? You're going to tap very gently their point, but not state it in a negative way. You're going to talk about it in a more general way. right? You're going to reframe it, right? Diet is one of several factors that can contribute to cavities. Brushing teeth regularly is also a key factor, and now kind of you take it in a different direction, and don't let them trap you in this, aren't lots of kids drinking lots of soda and eating lots of candy, and isn't that terrible, and aren't parents failing to do their job, right? We don't want to operate in that space. That's completely negative. It's not productive. So this is one example of an answer. You could also respond this way, which could be a way to educate the reporter or the talk show host, while also, again, not getting trapped in that negative frame, right? By letting them know, hey, sometimes parents aren't choosing water for a reason you may not be aware of, and here it is, right? So it's an opportunity to pivot away from and not get trapped in the negative language. There's also an answer like this, right? And I think what I like about this answer is it suddenly doesn't them the problem. It doesn't talk about those people, right? We don't want that language. If you're a parent and you can say, as a parent, I know that it's very easy to lose track of things. You want to work hard. You're doing things. There are a lot of stresses happening around you, and none of us are perfect. It's a nice way to kind of diffuse the situation and not get stuck in that Blameville. Okay, during the interview, this is a really key point, right? An interview may start off pretty good. You get kind of a general question. Usually the first question out of the box is a pretty general one and not difficult at all. But staying on message can be a challenge. So I want to share with you 3 strategies to help you stay on message. The first one is flagging. We're going to talk about each of these. The second is bridging, and the third is deflecting. And the third you may need to use sometimes, probably not all that often. Okay, what do we mean when we say flagging? Flagging is a way to really amplify and shine a spotlight on your key points. Just when you feel like the interviewer is taking you off course, it's a good way to kind of get you back grounded in the core issues. And these are some phrases that are classic flagging phrases. Here's the critical issue. That's why our primary goal is to, the most important thing for a parent to know is that, so all of these phrases are short, simple ways to kind of bring it back home, right? And in a polite way to not let an interviewer, either deliberately or just because they haven't really prepared themselves to interview you, to not let this thing get way off course. Bridging is when you bridge back to your key points, right? You're trying to find a way to get back to where the conversation ideally should be. And so here's what we're talking about here. So if you get a question like this, what about regular toothbrushing and limiting sugar intake? Don't you have to address those issues before you can improve children's dental health? Okay. To solve any problem, you have to start somewhere. Right? That's why the kindergarten oral health assessment is important, right? So with 2 sentences, you brought it back to COA, assuming that that's one of the key things you want to talk about, right? It may be, maybe the interview is going to be more about older adults or some other population, but let's assume it's about children's oral health. This is a classic way. That phrase, to solve any problem, you have to start somewhere, is just a nice way of saying, I'm going to bring it back here, right? By the way, notice something here. I'm not calling it COA. I'm calling it kindergarten oral health assessment. So if that reporter is going to use your quote in the newspaper article, it's better that it appears where it's all spelled out, right? Nobody has to guess what COA stands for. If you're on a radio or TV show, suppose somebody pops onto that program for only 5 minutes. If they hear you say COA 2 or 3 times, they may not have any context for what you're talking about, right? So even though you know what COA stands for, I really encourage you when you're giving answers to use the full 4-word title for what that is, and try to avoid saying COA, COA, COA over and over again. So again, I don't want to beat this to death, but this is a common direction that many reporters, not all, but many will kind of go. They'll at least have one question that gets into the blame game. And it's a frame that is unfortunately out there. Why is this problem happening? Who is responsible? And people try and take the easy way out, and blaming parents, blaming communities sometimes appears like an easy way out. And we don't want to contribute to that, right? So, when you get an answer like this, this is worded, as you'll see, in a more hostile way than the previous ones. And again, same thing here, right? This is a classic bridging phrase. We have to meet parents where they are. Providing information support, that's the way we can help them. So again, thinking of those phrases, having a few of those in your hip pocket so that when they try and take the interview a certain direction, you can pull them back. And instead of saying, well, I don't want to blame parents, or it's not fair to blame parents, right? They might use that quote in the newspaper article if you say it that way. If you say it that way during a live radio or TV interview, everybody hears that, right? So people kind of think, oh, I guess they're talking about parents and whether parents should be blamed for this or that, right? So don't use that language, don't get trapped, right? Okay, these are classic bridging phrases, right? They get you back. Like I said earlier, we can't lose sight of the fact, let's keep in mind, remember that statistic I shared about school attendance? Well, it's so important that children aren't missing instructional hours, and the kindergarten oral health assessment helps ensure that kids are on the right track, that they have healthy mouths and they're ready to learn, right? So, just thinking of those kinds of phrases. Last but not least on the 3 strategies is deflecting. So what are we talking about here? This is a pretty simple one. Sometimes a reporter or media host, they have you available. You're on the phone, or you're in their studio, or they met you for, a coffee to talk, at a coffee bar somewhere. And they figure, well, I've got this person. I've always wondered about this question. Maybe I'll ask them. But they may ask you a question that gets very technical. It may have to do with some area of clinical dentistry that you don't really feel comfortable answering. And for that reason, of course, you should not answer it. And so just having, being ready and feeling very comfortable to say, hey, I'd love to help point you in the right direction to get an answer to that question, but that's not my area of expertise. So give me your email address. I can send you information and suggest a few dental providers that you could talk to, or you could maybe talk to the state oral health director in California. They could probably answer that. So just make sure deflecting is getting that media person connected with the right person rather than stepping out and trying to answer a question that is not truly within your expertise. So after an interview, before we jump into this, I want to pause for a moment and Keiko, if there are any questions that people might have, they can post those in the Q&A. I don't know if people have posted any comments or questions in the chat box, but I'm certainly happy to take any questions people might have. I don't want to go too far in without giving you an opportunity to ask a question or to share a brief comment about perhaps an interview you've done in the last year or two, or any experience you've had with a person in the media.
Thank you, Matt. I don't see any questions or any comments at this point.
Okay, all right. Well, then I will proceed. But please feel free, if you have it doesn't have to be a question, if you have a quick comment of some sort, feel free to post that in the Q&A section. All right, so follow-up is really important. You get through the interview, hopefully you feel pretty good about it. Maybe you would have done something a little differently than the way you handled it, but this is like so many things in life. Practice makes perfect. The more you do this, you do get better at it. So, you learn from these experiences, and that's important to keep in mind. But the follow-up, as much as you may say to yourself, hey, feel like I got to the finish line, Not quite, because it is important to follow up with that media person, whether it's a blogger, an online editor, it's a newspaper reporter. You follow up with them after your interview. So what do? What is that follow up? Just a quick email is enough, or text. Whatever sort of venue or activity. Whatever you've established. If that reporter maybe texted you before the interview, you've got them already. It's easy to do there. That's fine too. I would generally say emails are going to be more helpful because I really think it's important to not just say, hey, thanks for interviewing me. Let me know if you need any more info. I really would encourage you to think about what else you might send. So there are a couple things beyond the thank you that I recommend. It can be helpful to send links to a couple of documents that you may have mentioned during your interview, and whether it's a study or a report or an infographic, whatever the case might be, sharing some of that is helpful. A lot of times, if you do that, the news outlet is more likely to actually post that on its website. And a lot of times at the end of articles, they will have for more info or additional resources, and they may have hyperlinks to those documents. They may post them and link back to them. So that's a victory. That's a helpful thing to do. Last but not least, consider whether it might be beneficial to suggest one or two other people they could interview to get helpful perspective, right? These are people, obviously you don't want to pick people's names out of a hat, right? But I'm talking about relationships you have. You may have a good relationship with somebody who is the clinic manager of an FQHC. You may have done a lot of work with, there may be a member of the faculty at a dental school or a school of public health, or there could be maybe a dentist in your community who's very connected with childhood advocates and can kind of speak to some of these things from a unique perspective. It may be a parent advocate. It could be a school nurse. So whomever it is, think about, are there maybe one, two, maybe three people max that you might suggest and maybe share their email address and say, hey, you might consider talking to these people. They're very knowledgeable and very connected and understand the challenge. Peter Hotez, I think probably many of you are familiar with Dr. Hotez. So he's based in Texas, and he's considered one of the nation's foremost experts on COVID and on vaccine development. And he is like, beyond just being a general rock star of public health, Dr. Hotez is always great about following up with media and reporters, and just taking a second to say, hey, thanks. He thanked the CBS affiliate in Houston, Texas on the right. CNBC interviewed him earlier this month, and Dr. Hotez just posted something on Twitter, quickly thanking the host for talking with him. And it gave him the opportunity to share a couple of quick stats, reinforcing what he talked about. So, he is somebody who knows how to handle the media. And to me, this kind of demonstrates it again. He's setting a very good example. Okay, what do you do if you've had that interview and you step away and you say, you know what, I think I may have misstated something. I think the way it came out was not what I intended. I'm not really sure. Or you may say, I know I said something that wasn't accurate. Now, if it's a live interview, you can always step back in and say, hey, the last answer I gave you, I want to clarify something. So, just step right back to it. Don't be shy. But if you don't realize that until after the interview, don't let a lot of time go by, right? Send an email right away to that reporter. Tell them, hey, I think I may have given you some information inadvertently that wasn't accurate. Here's the percentage of kids who are, who are getting the COA, are getting the kindergarten oral health assessment, in our county. And I just wanted to make sure you had that accurate figure. I think I may have given you an older figure, et cetera, right? So, don't let time pass by. If you think you may have said something wrong or given a fact or statistic that isn't quite accurate, this is always a good time to to follow up quickly and nip that in the bud, right? If you do this, you're going to be able to stop. They usually don't write their story and post it right away. So as long as you get back to them within an hour, hour and a half, maybe 2 hours, you're probably going to be okay. This is just a simple way to say, I think it's great, to thank them, to follow up, but just beware. I've known a few people who had the best of intentions, but they got a little overzealous, right? And so after doing an interview with a reporter, they 2 weeks later were sending a long email about a different topic. And then 3 weeks after that, they were sending another email, right? So just because you were interviewed doesn't mean that media outlet is dying to hear from you all the time. So, and it also almost makes you look desperate. So you don't want to overreact. It's great to have media outreach strategies, but you really want to connect those with times when you've got what you consider to be real news, right? You come out with new data that tells a good news story about how many kids are actually getting these oral health assessments. You come out with new data showing how attendance figures in the elementary grades are going up, and you think that some of that might be linked to the kindergarten oral health assessment, or there's a new report that's issued about California, and you want to give the local perspective as context for that statewide report. But you really want to have genuine news. Just the fact that you want to talk and get your issue out there is really not enough, right? So, just be careful about that. Be judicious. You don't want to send emails constantly. It's fine, if you want to follow up with something that's genuine news 3 or 4 months later, but be judicious, be strategic as you kind of make that consideration. All right, so let's see here. I want to provide an opportunity now for any questions or comments that people might have.
Yes, Matt, so I wanted to read off a couple comments and a question. So the first comment is from Dr. Pendekar. He said, thanks, Matt, for pointing out the importance of bridging back. Next one is a comment and a question from Dr. Juan Haynes. She says, great presentation. And she's asking, what about when reporter says this is off the record, thinking one should always assume everything you say is on the record?
Yes, Doctor, thank you so much for raising that issue. Yeah, I generally discourage the clients and the people I work with from speaking off the record. It can sound very reassuring, but the truth is there are a couple things you should know. First of all, the reporter could always decide to unremember, or they could genuinely forget, not out of ill intention, what part was on the record and what part was off the record. I think it's always a little dangerous to assume that that's going to play out. The other thing is there are different philosophies to this in journalism. There are some journalists who will say, for newspapers or media outlets, that just because a reporter has said this is off the record, it doesn't mean that their editor has to respect that. So again, that should be a source of concern. And I think you just really want to think twice, 3 times, 4 times before speaking off the record. There are reporters who will say that, hoping it will entice you to say something really juicy and controversial, which probably isn't really the place we want to be anyway, right? We've got an important issue here. We don't have to throw a lot of razzle dazzle or make wild claims. This is a huge problem and it's preventable. So I think the doctor is very wise and strategic to kind of throw that caution out. And I appreciate you for doing that. I would definitely say, don't speak off the record. It's something that will often blow up in your face.
Great, thank you, Matt. So another question, this is a 2-part question coming from Karen Raju. She's asking, I have a general question. For example, if you're interviewed by someone who has opposing ideology, maybe he or she is against water fluoridation, and brings you in a spot where you're uncomfortable and feel that you cannot deflect more. How do you calmly and respectfully bring the conversation to a neutral middle ground And second, are there any strategies to address address this than deflecting?
Yeah, that's a very good question. So, there are different areas of our field, unfortunately, that can become ensnared in this sense of controversy. I think it's often a false controversy, but they are out there, right? I think many of you have heard the issues about mercury and amalgam and so forth. But I would say far and above any other topic, fluoride is one that can bring out a lot of intensity on both sides. And opponents can be very vociferous about this. And they're right to ask questions. We all need to ask questions. But I think, we can feel pretty confident about where the science is. So you're in a situation, you're being interviewed, and somebody makes it pretty clear. They may otherwise agree with you, but they say, well, fluoride is toxic. There are lots of studies that prove that, don't they? There's, I think, a couple things to say. I actually think we do ourselves a big favor if we diffuse that by saying fluoride, like many things, like iron, like calcium, can be toxic if it's consumed at unusually high levels. And that's why we want to make sure that we keep fluoride at a level that is not too low or not too high. And that's the aim of community water fluoridation. It's also the aim of toothpaste. That's why we make recommendations to parents on how much toothpaste to use for young children. And so, acknowledging that that it's not a question of yes, no, toxicity is a question of how much. And so I think that's one way to kind of deal with it. I think if it gets very intense and you get somebody who says, well, I've done my research and I know this is toxic and it's evil, and I would never put fluoride toothpaste in my mouth, blah, blah, blah. I think what you can say is, well, look, you and I both want to see our community be as healthy as it possibly can be. We just disagree on how to get there. What are the strategies we should use to achieve that? That doesn't mean we have to vilify each other or name call. I want to do what I can to promote better oral health and educate people. And if we don't see eye to eye on this issue, let's focus on where we do see eye to eye. So I think that's more of a response I would use for a blogger or a radio show host or something like that. For a newspaper reporter, it's a little different, right? Because that reporter is not front and center like a TV show or radio show. The host is a big part of that program, right? But a reporter for a newspaper or magazine is a very different place. So I think when they bring up studies, I think the key thing is don't let them put you on the hot seat by assuming you're going to respond to every single obscure study they might raise or report from China or India or this country or that country. So I would say, look, we respect, our health department respects the guidance of the U.S. Department of Health and Human Services, the Centers for Disease Control and Prevention, and other expert bodies that have studied these issues, like the leading organization for dentists and the leading organization for pediatricians in America. And on the basis of the research that they've shared and on the basis of their recommendations, we support community water fluoridation. If you have a study or information that you think should change that, I would certainly encourage you to share that information with the CDC or these other organizations. So, and again, it doesn't put you're not the person who's the expert saying, hey, I know all there is to know about fluoridation. But I do respect these organizations that take the time to review the research and come up with recommendations. So I think that might be one way to not let them put you on the hot seat and make it sound as though you've got to respond to every single study they might share. Is that helpful at all? Hopefully it is. Please feel free to post under comment and we can continue the dialogue. Keiko, anything else?
No, so just looping back, Karen said this is helpful. Thank you so much.
Oh, good. Oh, good. Yeah. Yeah. And, I offer this advice and I will tell you, while I have rarely been interviewed, usually I'm the person setting up the interview, coaching other people to be interviewed. I've done a few of these on background or, on the record. They're not easy. I've done several of them. It is tricky, but you will get better with practice. And some of the preparatory steps that I lay out here, you may sometimes wonder, is it really necessary to do this before the interview? Trust me, you will feel so much more confident and you will be prepared in a way that you wouldn't otherwise. So Nancy Rios from UCSF is has been kind enough to agree to engage in a role play exercise. And I see we have maybe a few things posted in the Q&A. We'll come back to those and I will answer those or attempt to answer them as best I can. But Nancy and I are going to role play this. So I think, I gave you some examples on slides, but it's not the same as really having to do this in real time. And so I wanted to have a scenario here where Nancy's wearing the hat of a reporter and I'm responding to those questions. And then we can stop after I've given answers and I can give you a few explanations and I would love your feedback on which answer you like the best or whether you think that answer would work for you or anything you have, any criticism you have, why you think it wouldn't work. Nancy?
Mr. Jacob, good morning. I am Nancy.
Good morning.
How are you? I am Nancy Rios
I'm doing
with
great.
UCSF, and I am a reporter for our newspaper. And I have a couple of questions for you. Would you have a minute?
Absolutely.
All right. My first question is, our public schools have so many rules and mandates that they must comply with. Some school leaders might see the kindergarten oral health assessment as a check the box kind of mandate. Is getting a dental exam as important as you say it is?
School leaders who are aware of the kindergarten oral health assessment feel very positive about it. Why? Because they know it will help improve learning. Studies show that children with healthy mouths miss fewer days of school and earn higher grades. And one more thing, keep in mind that the kindergarten oral health assessment is also a way to diagnose tooth decay in children. This allows kids to have their cavities treated before they become a more serious infection.
Great.
Okay. Nancy, thank you so much. Let's stop before we go to the next question. So when you heard me say, keep in mind, right? So this is a classic example of when I talked about flagging and bridging. So this is a way to pull people back, right? To take the interview away from this frame of so many rules, so many regulations on schools, to a better place, right? To a more productive topic. And so that's why I use that as an example. Nancy, if you want to go ahead and ask the next question you have, we'll go ahead and answer that, and then we'll open it up for comments and feedback, and people can tell me what answers they like the best, what answers they might have changed in their own way, and that's fine. I am presenting to you, but we can always, when we work together, when we strategize together, I think these answers and all of the work product that we do gets a little better. So Nancy, go ahead.
So my second question to you is, what about the cost of all of these dental exams? Has anyone calculated the return on investment from requiring every school parent in California to get their child screened?
The kindergarten oral health assessment provides a great return on investment. It does this by saving school districts money. And when it comes to our schools, as you know, every dollar counts. Here's the bottom line. Schools are funded based on their average daily attendance. Our schools lose at least $29 million each year because of dental-related absences. So by reducing student absences, the kindergarten oral health assessment can help schools avoid losing this funding. Okay.
Thank you.
So Thank you. And Nancy, thanks for stepping in and playing that role. So you heard me say, here's the bottom line, right? That is a classic flagging statement, right? That's a phrase where I'm trying to flag for the reporter, here's what you should really pay attention to, right? It doesn't mean that they're guaranteed to pay attention to that, but it is a way of subtly, maybe not so subtly, reinforcing, here's what's really important. Here's what matters, right? And did you notice how I slowed down when I was saying that point about our schools lose at least $29 million each year because of dental-related absences? So inflection, pacing, you know, when you've got a key statistic like that, give it some room to breathe. Try to slow down a little bit and really let that sink into your audience. Sometimes we will spit out statistics or percentages and we step over them so quickly, people don't really have the time to process them. So I really encourage you to, you know, vary your modulation and your tone and your inflection. All right, Keiko, we're open for any comments or questions people might have.
Yes, great. Thank you, Matt. So there's a question from Therese McCluskey. Says, can you share some of your key themes about oral health, like the front door to your body?
Oh, absolutely. Yeah, I'd be happy to do that. I can share that with the UCSF team, and I don't like have them sort of on a single page right this moment, but I can certainly share that information in the next few days with Keiko's team, and they can, you know, transmit that information. I'll also share the actual PDF of these slides for those of you who might want to look at it again. But I'm glad you felt that was helpful. But I think any way we can make what we're talking about more vivid and more meaningful, I think is helpful. So I appreciate your request. And if I have some other examples of that, I'll put those together and share that.
So we don't have any questions or comments, but we still have a lot of time. So if there are any questions, please go ahead and type it in the Q&A or the chat box.
And I would love also, Keiko, to hear if anybody has just even wants to share, you know, quick info about any recent interviews they've done with local media, a daily newspaper, a community newspaper, a blogger, anybody, and just give me a sense of, did you inadvertently or deliberately use any of these techniques, and did you find them helpful? That would be interesting for me to hear, and perhaps for others.
Yes, yeah, that'll be great. If you have a story you want to share, if you can raise your hand, I can go ahead and unmute you. Okay, so there's another question, Matt. This is also from Karen. How important is using humor in media engagements related to oral health?
Oh gosh, that is such a good question. And I look for ways to use humor when possible, but I will tell you, it can be really, really tough because, you know, what may be humorous to me might not be humorous to somebody else, just because of their personality, because of their cultural experience, because of their lived experience. And so I tend to be very hesitant about, you know, just using some joke that I thought was amusing. I think that one of the best ways, you know, to use humor can be in a self-effacing way. I think sometimes it's a way when you're giving a presentation or a talk, whether it's a presentation to a stakeholder group or you're talking to a reporter, it can make the reporter, help them to see you as more human. That may sound strange, but, you know, I think it's important for them to not see you as, oh, you're just a spokesperson. You're just, you know, you've got a talking points and you're just going to give those to me. But telling them a brief story about yourself that might be somewhat illustrative of why you care about this issue, what got you involved, I think could be a nice way just to help them understand you, see you as authentic, and understand that your interest in this issue is really based on your personal values. I mean, I've heard some very powerful statements through the years from people. I always like to tell the story about how I got my job at Pew, and I always wanted to work for Pew. And so when I heard they had a job for a communications manager or director, I was really eager. And then when my friend who worked there said, I said, well, what's the project? And they said, well, it's the Children's Dental Health Project. And I said to myself, dental? I'd never worked in that field before. And I told him, I said, you know, I'm not sure if I will find that interesting. And so I will sometimes tell people that story today because it really demonstrated to me how fascinating this topic is. I no longer work at Pew, but I'm still very much focused. Most of my work is focused on oral health because this is an issue that I think is so critical and we can make real progress. It's preventable. So anyway, I think I've used that story a few times with audiences when I've given presentations or talks, and I've found that it seems to resonate, that they appreciate my honesty, number one, for admitting I wasn't always so, you know, super excited about this issue, but also as a way to be authentic, to let them know that I had come to see this issue as so meaningful and so important. So I think that might be one example of where, I'm not sure if I'd quite call that humor, but you can tell that kind of story in a way that is humorous. So I think self-effacing, self-revelatory stories can be a way to introduce humor. But if it's more of a traditional joke, I would really make it a point to share that with people who are diverse, not just, you know, in my case, I would not want to just share that joke with white males. I would want to share it with females and people of color and make sure, okay, does this joke, do you consider it funny? Is it in any way insulting or negative, or, you know, is it a sense of shame, or, you know, so I think that's just important. Somebody posted, Keiko, on the chat, I love this, brush the teeth you want to keep. I love that. I think that is so, you know, anything we can do that really takes our issue from a very clinical epidemiological place and really makes it so relevant to people's everyday lives, I think is helpful. And that kind of a phrase is one small way, I think, to do that.
Yeah, and a comment from Dr. Montaigne saying great role play examples.
Yeah, we weren't originally going to do role plays, and I want to thank Dr. Steven Silverstein. He suggested doing some role plays, and I thought that's a really great idea. And I want to thank Nancy Rios for agreeing to be to wear the hat of the reporter, media person. So I don't know, you know, media coverage is something that, you know, it's not going to come every week or even every month, but being ready for it can really help you to be prepared when events suddenly put it, you know, on the radar screen. So let me give you a quick example. Let's suppose you don't have a report in the works. You can't think of anything for the next few months that is likely to open an opportunity to tell a story or to talk about the importance of oral health locally. One thing that I would recommend that is something worth considering. So the New York Times, in their Sunday magazine, they have not a long story, but it's a very good story about oral health. And they talk about the fact that because so many people lost their jobs and lost dental coverage during the pandemic, so many people couldn't get in to see a dentist because briefly dental offices were closed and they were only handling emergency cases. They had some survey data showing that there's the view that there is likely to be a spike in dental disease among adults and perhaps as well for children. You might share that story as a kind of an FYI with a local reporter. That could be a way of you know, as long as you keep it brief, it could be a way of introducing yourself to a newspaper reporter or a local health blogger or someone like that, and putting what you're doing on their radar screen. And they who knows, they might ask you, well, what's going on locally, right? So sometimes national stories can kind of provide a little opportunity for you to reach out and say, hey, I wanted to bring this issue to your attention. We're working a lot on this issue for children's oral health here in, San Diego County or here in Marin County or what have you. We'd love to talk to you about it. We've got some interesting stuff to talk about. So anyway, think about that, when you see a story on NBC News or the New York Times or the LA Times, it can be a good opportunity.
So I'm not seeing any
Well,
questions right now.
Yeah, well, people may not have had recent media opportunities, or maybe they didn't go so well. I'm not sure, but I do hope that I've given you some strategies that can make you feel more confident as you begin planning and developing, activities and outreach, because all of you are. I saw some data that Dr. Kumar shared from the state of California and their new report on oral health, and very impressive to see declines in decay prevalence. It's, I think, a testimony to a lot of the hard work that so many of you are doing at that local community level, and raising awareness and so forth, and promoting the kindergarten oral health assessment. So that is Keiko, are you still there?
Yes, I'm here. I think
Okay.
we froze a little
All
bit.
right.
So
Yeah.
okay. So there is a comment and a question from Dr. Monzade. I said, this has been great. A question on how to frame activities and new initiatives to create excitement, but not overpromise, but also create collaborations.
Wow, there's a lot there to unpack.
Yes.
So
Matt, I'm not sure if it's just me. I think you are on mute.
Yeah. There.
okay, can you hear me now?
Yes.
Okay, all right, sorry about that. So there's a lot to unpack in that question. I'm going to try and kind of take it in pieces, because I think that some of the strategies to enhance collaboration opportunities are going to be a little different than media. But I think if you're starting a new program or project, I think that it is important to have a goal, right? A lot of reporters and media people are going to want to know, well, what's the objective? What are you trying to do? And they're going to want to hear more than just, we want to improve children's oral health. So to the extent that you can say there is some kind of benchmark, there's some objective here, and it is to ensure that, student absenteeism in the elementary grades of our local unified school district drop by 10% or 15% or, whatever. I do think that is more likely to get their attention. They're going to see that as a real initiative, right? Oh, wow. They're setting a goal and they're really saying this is what we want to do. So I think if you feel comfortable putting some kind of goal out there, I think that is one way to help get media coverage. If you just say, we've got this problem, we want to make progress on it, it's not quite as strong. I think that it's important, again, like we talked about sound bites. I think the same is true in media outreach of connecting those dots. You don't want that reporter to walk away saying, oh, this is a press release about dental health. You want them to understand this is about a whole lot more than just the health of children's mouths or adults' mouths. It is about our quality of life, our ability to make friends and socialize, our ability to learn in school, to attend school, our ability to find a good job, right? And when you get tired of saying that, you're almost saying it enough, right? I mean, reinforcing those points. For collaboration, I think it is a little different. I think that you know, connecting those dots can be a helpful way, though, to liaise with a group, for example, that may focus a lot on the issue of diabetes, maybe in the community. Maybe that's one of their priorities. In understanding that a healthy mouth can help somebody with diabetes keep their blood sugar under control, is that can be an educational opportunity. So sometimes the collaboration, the partners you choose and reach out to are really a win-win, because they allow you to highlight oral health, but this other stakeholder says, hey, this is a great way for us to reach an oral health audience and help them understand why diabetes care and maintenance and, you know, health is so important. So I think thinking about that a little bit is important. I think that, you know, there's also a lot of talk about, you know, during the pandemic, so many people were spending much more time at home. And so, you know, thinking about opportunities to bring that up and point out that, you know, as important as it is to see a dentist regularly, to get regular dental care, we also want to emphasize that we need to do more to help families understand what they can do at home to help prevent decay for themselves or their children. And so it really pays off if we do a better job of educating. If we ever have to go through something like this again, or people are sequestered at home, that we can be a little more confident that parents will be more aware of some of the steps they can take, simple but powerful steps to help prevent decay. So I don't know, that's a lot to unpack. And what I would say is, if that person wants to reach out to me directly, I will try and do a better job of really sorting it out. But there are a lot of pieces to that.
Thank you, Matt. So we still have a little more time. If folks have any questions, please go ahead and type it in the Q&A or the chat box. Or if you want to share your experience, we would love to hear it. So if you can go ahead and raise your hand, I can unmute you.
Another thing that you could share with us is, you know, is there a local media outlet or TV show or whatnot that you would really love to be able to get on or get coverage from? That might be interesting just to share with people. You know, is there a particular radio show that reaches a certain segment of your community that you've kind of just begun strategizing? You know, how would we make that happen? That I would find that interesting if you have kind of some media targets you're trying to work on.
So I'm not seeing any comments or Q&A in the Q&A box or any raised hands. All right. Well, if there are no further questions, or if you come up with other questions later on, please go ahead and maybe email myself or email Matt. Oh, actually, Matt, there's another question. Spoke too fast.
Yeah, I see it. Yep.
Okay. So it says
media
Dr.
targeting.
Monsalve.
Yes. Yeah. So I think there are two ways to approach this. Sometimes you want to think about which media outlet do you think is going to be more interested in your information, right? The story that you're going to tell with a report or with new data. And so I always say that if there are local NPR affiliates in your area, public TV and public radio tend to treat these issues with a lot of care, a lot of attention. They go deep, they are interested in the details, and they generally get them right. But here's the one issue is that you also want to kind of think about how do we reach our target audience? And in many cases, your target audience may not be consuming public TV or independent or public radio, NPR, and so forth. So you really have to kind of find that balance. And so if you've got a target population, sometimes even if it doesn't have to be a big media, it can be a community newspaper or even a newsletter that is distributed by the local United Way chapter at gymnasiums and recreational facilities that parents read. We tend to think, oh, hey, it's great if you get the big newspapers and TV stations to cover it, and that's fine. That is good. That's very nice. But it doesn't have to be a big splashy media outlet. Sometimes those community newspapers reach your target audiences in a really good way, and they have a credibility built into them. So if you can submit an article or get them to publish something, I know the local oral health program in the coalition they put together in Marin County did a really good job of finding a community newsletter that would agree to run a column that they submitted. So they don't have to be big splashy media outlets. I think that you want to think big, but you want to sometimes starting small and thinking of those audiences that are going to be reaching parents, reaching members of communities that don't always feel like mainstream media reach them. So that's something to think about.
Great, thank you. So we still have time for a couple more questions. I am not seeing any questions or any comments at this point. So if there are no further questions, I want to go ahead and thank Matt. It's been a wonderful presentation. All the tips and strategies you shared with us is very helpful. And I wanted to thank all of you for attending during our lunchtime session. And also before closing the webinar, I would like to remind everyone about the post survey following this session. If you can please complete the short survey, we appreciate your participation. So this will conclude today's Lunch and Learn. Thank you all for attending, and we hope you enjoyed this presentation. We hope to see everyone at our next Lunch and Learn. Thank you so much and have a wonderful day.